Doctor, we live in a time that's just really busy, and people may not have the time to recover with a full facelift. I call it old-fashioned, but the good old-fashioned facelift, how long does it take to recover from one of those?
About 4 to 6 weeks on average.
All right, so people may not have that kind of time. Are there procedures today that can be done that are maybe just as good and have less recovery time?
We are so lucky nowadays that we have options which are minimally invasive, offer minimal to no downtime, that can help us erase some of the lines that Mother Nature has painted across our faces.
All right, something comes to mind is Thermage. Tell us about that.
Thermage is radiofrequency tightening of the face. We call it the non-surgical facelift. It doesn't do the full effect of what a facelift does, but if you trade in the length of recovery time, which is none, to the 4 to 6 weeks, it's excellent for tightening, lifting the skin.
When you say lifting your skin, do you literally mean lifting the skin?
What it does, it stimulates the production of new collagen. Collagen is the thing that allows our tissues to sag. And so if you have collagen, it'll lift things up. And in fact, it actually causes collagen to bend. So it plumps up the tissues immediately, and then you have a delayed response up to 6 months later of new collagen being made.
Do you ever have to go in for a tune-up, or do you ever need any more Thermage down the road?
It's a one-time treatment because it is a permanent option. However, we all continue to age. So sometimes people come in every 3 years or so for a tune-up.
Let's switch gears for a moment. Let's talk about Botox. Is it good? Is it bad? Are people still using it?
We're using a lot of it. Botox is one of the most popular options for people. I want to clear up a misconception, though, that I see. People think that Botox is a filler, and it's not. Basically, Botox paralyzes the muscles that form the wrinkles. So if you have two muscles that work to make a wrinkle and you paralyze either one, it flattens that out. So if you have a deep wrinkle that's already formed, it helps to prevent it from worsening. And then you can have something like a filler, such as Restylane, Radiesse, Juvederm, and if there's a valley, I fill that in with the filler.
One of the things that if somebody is not sure of which procedure they'd like to have happen, and they call you for a consultation and come in and say, hey, this is what I want to have done.
Most of my patients, I'm very honest about what I think people need, so they come in and I tell them, based on their face, because everybody's very different, what I think would be a best option.
Okay, would Botox for me, would it work? Would it be it?
Yes, I really want to inject your forehead.
Do you want to?
I do.
Do you? I mean, you could really do some wonders on my forehead with Botox.
I could, and between your brows as well.
Now, how much downtime is there?
There's none. You might have a little bit of bruising, that's it.
Once the bruising's gone,
then you're fine.
You
It works
great?
about 3 to 4 days later, so it's not immediate
Oh, it takes a few days.
for the toxin to work.
The misconception seems to be that Botox numbs your face.
No, it's not numb at all. The muscles are the things that contract to give you the wrinkle, so you can't frown as consistently. It just depends on what you want to do. You can actually have somewhat of a chemical brow lift if done appropriately.
Well, one of the things you can do is call you, of course, and to set up an appointment and get a consultation.
Absolutely.
And also check the website for more. All right, I want to take a look at this cosmetic product that you have. It's the Dr. Ruanthi Campano product line of cosmetics. Check this one out.